Hey there, everybody. Dr. G at Florida Concierge Medicine and Wellness, and this is the very first edition of the 15-minute consult with Dr. G. I have a very special guest for the first edition by the name of Cindy Marcelin. She is Miss CinCycle.
There we go.
She is Miss CinCycle. And she is going to give us some insight into who she is and why she does what she does here in South Florida. But first, let's talk about what the 15-minute consult with Dr. G is all about. Florida Concierge Medicine and Wellness and myself, we have a mission, and our mission is to put information in front of the community in a way that we include everyone, increase access, and increase the possibility for all of our patients to make better informed decisions. So what does that mean? That means I have a responsibility as their doctor to mine out services and adjacent medical services in the community and bring that into my office and explain all of these services and how it can affect and improve medical outcomes to all of my patients. Also, in my office, I'm all about informing my patients about what's going on with their bodies. So with the information that they have about what services are available and what I am giving them and what's happening to their body and what I'm giving them to help to improve, we have better outcomes overall. And that's where I come into meeting people like Miss Cindy, who is an amazing, amazing person, an amazing spin instructor, and also an amazing entrepreneur that you're gonna get to know in the next 15 minutes. So, Miss Cindy, I'm going to give you the mic right now, and you can go ahead and let these people know exactly what you do, why you do it, who you are, and what your mission is.
So hi, everyone. My name is Cindy Marcelin. I am a full-time educator during the day, and I always tell people that I am a spin instructor at night. So that's my passion, that's my side hustle that I hope to upscale and make a full-time, full-fledged business in the next 5 years. That's ultimately the goal. But I started spinning in the year 2012, and then I decided to become an instructor in 2017 after I was having trouble finding a spin class that played the music that I wanted to hear and taught it in a way that I thought was in alignment with my needs at the time, because I had just recently gave birth to my daughter and I wanted to get back in shape, but I needed that motivation and it was nowhere to be found. So I've always been told that if there's a void, fill it. So I always view myself as an instructor that was able to fill a void that was missing in the fitness community. So that pretty much sums up my why, and it's been amazing. I've been, I would say, kind of successful, but most importantly, I have been able to connect with some amazing people from all walks of life. That has been the number one benefit and advantage of becoming a spin instructor, in addition to the free memberships at the gym.
Outstanding, outstanding. What a great story. What a good story. So now after we learned a little bit about Miss Cindy and what she does and why she does it, we're going to take some questions. We had some questions sent in to us, and the first question is for you, Cindy. It says here, how are you different than other spin instructors, and why do you choose to be different?
So, very first thing that's different about me is, I would say, my physique. I am a plus size Black woman teaching a fitness format that has been predominantly controlled, and I would say even dominated by the majority, white women. White women typically take spin classes, and for the most part, it's an expensive fitness format. So right out the gate, when people walk into the spin room, they're not even looking at me as if I'm the instructor. They're often surprised. So that's what makes me different. Two, it's my choice of music. I'm a huge fan of hip hop, R&B, and also rap. So I like to also curate trap cycle classes, which can be controversial, not because it's Black music, but because it can be very vulgar. So, you know, some people like it, some people don't. Respectfully, you know, I'll continue to teach it. And I always throw out my disclaimer wherever I go. So for the most part, I've never had any pushback, but I always like to let my clients know what to anticipate, just out of respect. Third would be the fact that I do a lot of, I curate a lot of classes where we ride to the beat. Your typical spin class just wants you to ride and focus on RPM. I may be getting a little too technical, RPM, and just follow your watts. But I like rhythm. I think it's a cultural thing. In addition to being, I'm a Black woman, my parents are also from Haiti. So I think we do everything to the rhythm. Everything that we do is to a cadence, and we just like that whole, you know, 1-2 step thing. And I've been able to incorporate that into the spin class. So I think that's what makes me different. Can't think of anything else other than
amazing.
The music and the cadence.
We do share that. We are both Haitian.
Oh, so I send you a good one. Yes.
That's amazing.
Yes.
So there's a cultural component to your class. There's a rhythm component to your class.
Yes.
There's a gritty side to your class. You're all inclusive and also respectful at the same time. You let everybody know what to expect and how to get it, and you're going to go ahead and give it your way regardless. I like that. I like that. That's it. I think I got a good idea of what the class feels and sounds like.
Right, it's always a good time. And I just want to add, I think being a teacher makes this super easy for me, because if I'm dealing with teenagers, you know, 8 hours a day, I mean, dealing with a bunch of adults should be a breeze, right? It's not always a breeze. I would say sometimes it's easier working with children because you can tell them what to do, but with adults, it's a different approach. But having that experience makes it easier for me to navigate, because adults, when they're taking a fitness class, they want direction, but they don't want to be, they don't want you to become a dictator. They're still adults at the end of the day. So that little piece helps a lot as well.
That's interesting. A lot of my pediatrician friends, they say that they don't have problems with their patients. It's the parents that's the problem. But that's that's a different story. That's a different story for another day. I have another question for you that came in, if you don't mind. What has been your biggest challenge as a minority female making your mark in the South Florida fitness scene?
Breaking barriers surrounding what fitness should look like, or what fitness trainers should look like. I think we've made a lot of progress with that as a result of social media, and the fact that the platforms like Instagram allows you to see different trainers and different physiques. I think that has been helpful. But for me, at this point in my entrepreneurship journey, it's funding. That has been the biggest challenge. I have been applying for grants, trying to understand how, business works, because when you have been an employee, like I've been a teacher for over 17 years, and now I'm attempting to do something that is the complete opposite of what I'm accustomed to, those things can be very challenging. So the whole process of upscaling, taking risks, the thought of leaving your stable career to jump into an industry that is very tricky because fitness goes up and down. Those are the challenges that I would say I'm facing.
Wow, that's powerful. That's powerful.
But I'm not going to give up.
Absolutely not, and you shouldn't, because we need you, and we need people like you who come from a teaching background. And I understand that a coach is also a teacher. You are still, at heart, a teacher, and you're teaching not math or science or social studies. You're teaching people how to live a better life. You're teaching people how to get active. You're giving people, like us, that look like us, who haven't tried different modalities. We, traditionally stick to other things, to giving them different opportunities to get active and get healthy. So I commend what you're doing. and I would not ever recommend that you stop. And if I saw you stopping on the side of the road, I would definitely pick you up and drag you along and keep you going. So yeah, we need you in South Florida for sure, if not in the rest of the country. So keep going. Yeah, I think we have time for more questions. Do you have a question?
I do have a question. So I wanted your take or your perspective on the weight loss culture. So because as a fitness instructor, most people that go to the gym, they're looking to get fit, and that usually equates to losing weight. So as a medical doctor, what is your take on the status of weight loss culture? Like, are we making progress, or are we going somewhere where we shouldn't go? What are your thoughts on that? Because there's so many different opinions now.
Amazing question. 100% of the patients that come into my office get weighed. Their blood pressure is taken, their height is taken, and then we come out with numbers. And these numbers are used to guide us to make these decisions on what we're going to do, what we're going to recommend, what risk profile patients typically carry. And one of them is a controversial BMI. We don't have to go down that rabbit hole. We know that is a crazy number that was created in a fashion in which it was not all inclusive. So I don't discard the number, but I do use it as a guideline when I'm looking at my patient. So after I weigh my patient, be they 500 pounds or 100 pounds, the next question I ask them is, how do you feel about your weight? That's the very next question I ask them. Sometimes they don't feel happy about their weight because their weight is causing them other issues. Sometimes it's just a cosmetic thing. I don't know the way I look. Another time it's a confidence issue. Sometimes asking that question opens up a door as to where the weight is coming from. Comfort eating is one of the things that we uncover sometimes when we're looking at weight. Or then there's another metabolic issue. But you asked me specifically as to how I feel about losing weight. I guess if I understand your question correctly, losing weight for aesthetic purposes. If I'm, and is that tied into, something that I do just because of aesthetic purposes? That's not the way I approach medicine and I approach weight loss in my office. I'm always looking for a secondary reason why they should lose weight or not. There are patients that come into my office looking to lose weight, and they get turned away because they are already underweight or at an ideal weight that I believe that they're as healthy as possible. And then they say, well, I ask them, well, how do you feel about your weight? Oh, I just don't like the way I look, or I don't like it, but I feel fine. And they're at a good weight for their size. I'm not looking to lose weight because you can also cause problems. Like you said, we may be going down a road that we don't want to go, where we're causing more health issues by losing weight versus leaving a patient at where they are and getting them to be more active. That's the other component that I have, that 100% of my patients get recommendations for. Whether they weigh 100 pounds or weigh 500 pounds, activity. Get active. And I don't do diets. We do nutrition, good nutrition, right? So you get all of your nutrients, your vitamins, minerals, protein, all of those things, carbohydrates, all of those things in proper portions, along with your activity level. It builds a basis where we have less complications down the line, less obesity, of course, less cardiovascular disease, less stroke, less dementia, less kidney disease, less liver disease, less everything, when we see patients are maintaining a good weight for their body type and body size. And that typically, if you look at papers, doesn't happen at the normal, quote unquote, normal BMI. That happens around 27%. Less than 27%, if a patient is doing less than 27%, they're feeling good, they're active, I'm not in promoting weight loss. If they're above 27%, not active, have maybe a little bit of diabetes or high blood pressure, we do promote some weight loss down to 27% and then reassess. So 27%, if you're looking for a direct answer from me as to how I feel about weight loss, that's my line where I draw the line there, and then from there we reassess and see if more weight loss is needed.
Nice. So everything is based on medicine. It's about being healthy, and it's not about dieting, it's about nutrition.
Absolutely.
Awesome.
Absolutely.
Love it.
Absolutely. So I think with that, we have our 15 minutes is just about up. Everybody who's logged on and who have more questions, you are welcome to go ahead and ask us more questions, send us more questions in. Cin, what is your IG? Your IG tag?
My IG is CinCycle. It's CIN_CYCLE.
Go ahead and DM Cindy if you have any questions about her program, why she does it, if it can benefit you specifically here in South Florida. Of course, you can always contact me at FL Concierge Docs on IG, and DM us and ask any questions that you have. I also would be remiss to let you know that on January 20th, we are going to host our first fitness session, and of course, the fabulous CinCycle will be in the house, giving us a heck of a session with some good music. We're gonna enjoy it. We're gonna have a great time.
I won't go too crazy on you guys. I'll keep it somewhat clean, because I want to stay true to who I am and the format that I present, but I always try to give everyone like a PG-13 version first.
Keep it a little. It's okay. You can get a little gritty. It's okay. It's
I can
okay.
get a little gritty.
Get a little gritty.
Get everyone kind of comfortable to make everyone come back again. That's what it's all
definitely
about.
Going to have a great time. We are definitely going to have a great time, and we are here at Florida Concierge Medicine and Wellness, FCMW in Hollywood, Florida, are looking forward to it. Our patients are looking forward to it. We've had a great response so far. It's still a couple of days away, so yeah, I'm super excited as to what to come, and I'm looking forward to it. Okay, it was great.
I'm looking forward to you providing those that attend a lot of information and education, because as an educator, I believe education is the key to everything, every aspect of life. And I think what the weight loss culture, what we're missing is the education. So I just want to thank you for allowing me to come on your show and allowing me to share what I love to do, which is spin.
Thank you for including me as an educator. I do fashion myself an educator of medicine and medical choice and medical access information, so that my patients make better informed decisions, and that includes who to choose and who not to choose to go and go work out with, someone who is safe, who is knowledgeable, and who is going to take care of them and come back to me and tell them what a great time they had. So I appreciate that, and I cannot wait until your event with us. All right. So that's about it for the first episode of the 15-minute consult with Dr. G. So for Miss Cindy, myself, Dr. Cloak, Dr. G at FCMW, good night.
Good night.